Okay, thank you so much for welcoming us here in Carestream. I love coming to Paris and definitely also coming to Carestream. First time I was here early 90s. And as a professor in Leuven in radiology, I actually teach my students in the beginning of the academic year with the history of radiology. And I'm just wondering like how I can also tell them how Carestream fits in this history of radiology.
Yeah, good point. First, welcome to our site. For sure, Carestream starts with the beginning of digital radiology. As you know, we invented the digital sensor for intraoral application first.
RVG.
RVG sensor. That was in the 80s. And then step by step, we moved to panoramic sensors, small 3D sensors for CBCTs, and then more and more larger size. So we are a digital company. We didn't start with the argentic analog film. We started from the 80s from the digital sensor, and so digital imaging in dentistry.
Yeah, that is very interesting because, of course, we are representing Digital Dentistry Society, so everyone is very much into the digital. So you don't only fit in the, as I understand, in the radiology history, but also in the history of digital dentistry. Can you comment on that?
Yeah, it's true. I mean, we have been developing this application, starting with digital images, basic image in the beginning, and then more and more software for reviewing, for applications. Everything is being digital and bringing to where we are today and where we see in the future more and more digital application for the dentistry.
Yeah, and that's what I like about radiology as such. It's not only more and more central in the dental office, but I also see more and more opportunities. And like you mentioned already, you started with a small RVG and you went bigger, panoramic. So can you maybe comment on this history then, where CBCT and the hybrid machines come into play?
Yeah.
It's very interesting for me as a professor to know, but actually for every dentist, because I think it's now getting more and more central place. So how Carestream fit in, it's interesting to see.
At least it's a coherent and progressive move. We talk about the RVG intraoral sensor. We went through the 2D cassette to digitalize analog panoramic. Then we launched early 2000 the first panoramic, not the first panoramic in the world, but the first one dedicated to the dentist, not to the radiologist, not to the imaging center. So easy to use, a good price for the dentist. And then this was this machine with the rotation around the head.
And it was already digital?
It was from the beginning. We never did any analog. And then from that type of machine, we moved to the first dentist-oriented CBCT in 2007 with a small field of view to start with a smaller sensor. And so that was the beginning of the CBCT adventure. So that's about 15 years ago. And we moved to a larger field of view and more advanced imaging processing. And then step by step to more digital processing of the data, the image. Now with artificial intelligence, AI integrated in our software. And as you say, not only locally on-premise, but also sharing case with some colleagues, sending the data to a lab for some appliance or whatever. Yeah. So the world is getting more and more connected, and everything starts from the image with processing and sharing around for back and forth.
So as you tell it now, I believe, it's a kind of the image as the core where we care and by streamlining the whole process, and then it's Carestream. So I can see that your name is linked to the digital dental workflows. Yeah, that's very nice. And how do you think you can keep up this pioneering position which you had from the RVG introduction in this highly competitive world on cone beam?
Yeah. So we still think, and our strategy is to keep the workflow from A to Z. So image acquisition is important. And it's even more important today to have very good quality of image, because this is the raw data which is used for processing and having treatment planning applications, diagnostic, and other type of applications. And in this case, we have been doing for years and still do our own sensors. we are fully integrated. We design our sensors and we manufacture our sensors, which is not the case by far for all our competitors. So we control the quality of the image, and then we can work on software applications to do that. And that this evolution is very much developing more and more software, because the machine is quite mature, I would say today.
Like also the AI developments.
AI development, cloud-based application, and there is always a mix of on-premise and cloud, because at the end, the dental office is where it happens in terms of treatment, but we need the whole ecosystem to help the doctor to diagnose, to prepare, and to execute the care.
Yeah. May I tell you, like, because I asked you a question about the future, my dream machine would be a machine, and I told your colleagues already, like it would be a machine where you can tell the AI that is this patient and this indication, and that it goes with the AI for the right thing. So I hope, I see already that your company is at the core of the dental digital practice, but I hope that this dream machine may come from this factory.
Your dream may come true, maybe faster than you expect. But it's true that today we are working on the easy-to-use automated machine, using AI to help the doctor or the assistant, because it's not always the doctor who is at the machine, and then having this develop in a way that it's not just mechanical and technical preparation and acquisition. It's a clinical definition. As you say, I want to do this case for this tooth, and then the machine and the software will drive not only the acquisition, but also the treatment to prepare the next step. The doctor will still have the control. AI is not taking the place of the doctor, but the doctor will have to control and validate, but the machine will help to develop all the workflow, which means quality, coherence, and productivity.
Well, thank you so much. I think indeed I have a dream now, and my dream may come true, but I thank you very much for this enlightening interview.
Thank you very much.
And congratulations with your certification.
Thank you very much.
For the Digital Dentistry Society. Hope to see your company in Venice and the next congresses that come afterwards.
Thank you very much.
Thank you.